the Honourable Member for Halifax.
Merci, Monsieur le Président. Je veux parler.
Thank you, Mr. Speaker. I'd like to talk about the promise about maternal health and the G8, and I'm very happy to take part in the debate. I will be sharing my time with the member for Vancouver West.
Is specifically about the inclusion of family planning and sexual reproductive health options. However, I'd like to talk about this motion within the greater context of maternal and child health and Canada's failure to and potential to act on this important global issue. Nous avons entendu de la part.
We've heard from the Prime Minister that the major project, which will be presented by Canada during the G8 summit in June, will be an initiative to decrease the rate of mortality, of maternal mortality and child mortality in developing countries. The government has asserted from the very beginning that the planning programs, family planning programs, will not be part of the initiative, saying that the objective was to save lives. He then reversed his position by saying that family planning was a file which had always been considered as an area for action.
Presented as a holistic approach that focuses on clean water, vaccinations, nutrition, and training for healthcare workers. However, we have no confirmation that it will include access to family planning, and no funds have yet been allocated. Mr. Speaker, I have some statistics, some key statistics that I'd like to share with you, and I hope will shed some light on this issue. L'accès à un moyen de contraception.
Access to contraception and the choice to whether, and reproductive choice rather, are recognized as being means of saving lives. According to the World Health Organization, the first stage in avoiding deaths among new mothers is to make sure that these women have access to family planning and to safe abortion services.
5% of maternal and child deaths in the developing world by preventing risky births that are too close together, too early, or too late in a woman's life. Modern contraception helps fight the spread of HIV and AIDS by allowing HIV-positive women to space births for optimal health and access services to prevent mother-to-child transmission. And every year, an estimated 74,000 women around the world die as a result of unsafe abortions. This could be prevented with contraception and access to safe abortion facilities.
By refusing to make family planning part of the initiative on maternal health, I believe that this government is disconnected from the international community.
Like President Obama, who recently revoked the global gag rule, a policy that barred any foreign organization from receiving U.S. funds for providing, advocating, informing, or counseling women on abortion in his first week of office. Dans un livre blanc sur...
In a white paper on international development, published in 2009, the United Kingdom asked for abortion services in sanitary conditions in those countries where the procedure is legal, and an increase by 1/3 of the number of users of contraceptives. The European Union affirmed that measures taken at the G8 would be based on the Cairo Declaration of 1994, which targets the assurance of universal access to reproductive health care between now and 2015.
A series of 8 international development goals that all 192 UN member states agreed to achieve by the year 2015, a year that really is just around the corner. Goal 5 states that we commit to improving maternal health by reducing maternal mortality and allowing people universal access to reproductive health. Remember, this was agreed to by all 192 UN member states, including Canada, Mr. Speaker. J'ai une fiche ici, une fiche de...
I have an information sheet here from the United Nations, and this information sheet states that the vast majority of deaths among mothers are in fact avoidable. In industrialized countries, death following pregnancy or giving birth are in fact rare. The mortality rate for mothers remains unacceptable in many developing countries in the world. Reaching Objective 5 means reducing or cutting by 3/4 the mortality rate between 1990 and 2015 among mothers. And this is a real challenge. And this is an area where there's been the least progress made.
And WHO, the World Health Organization, up to 15% of pregnant women in all population groups experience potentially fatal complications during birth. 20 million women each year. More than 80% of maternal deaths worldwide are due to 5 direct causes: hemorrhage, sepsis, unsafe abortion, obstructed labor, and hypertensive disease of pregnancy. In about 21% of the 500,000 maternal deaths occurring each year, women die as a result of severe bleeding. This complication can kill a woman in less than 2 hours. Control of bleeding, replacement of blood, or fast emergency evacuation is needed to save lives. Cette fiche aussi demande la question.
This information sheet also asks the question, what do they intend to do? And there's a broad list of initiatives, including funds to strengthen the healthcare system, in particular for mothers' health, children's health, and also by ensuring the purchase and distribution of contraception.
Programs to reduce maternal mortality and ensure universal access to reproductive health care, including family planning services. Adopt and implement policies that protect poor families from the catastrophic consequences of unaffordable maternity care, including through access to health insurance or free services. Améliorer l'accès à la contraception.
Improve access to contraception and sexual health advice for men, women and teenagers. Protect pregnant women from domestic violence and get men involved in the health care of and care in general of pregnant women.
To protect poor families from these kinds of catastrophic consequences. We have known these things for years now, Mr. Speaker, and yet we still have not seen action in a serious way. Lorsqu'on examine les faits, une chose...
When you look at the facts, one thing is quite clear, and that is the Liberals haven't lived up to their responsibilities with respect to developing companies. Given this failure, what guarantee do we have that they'll be able to hold the government to account when it comes to maternal health?
Not words. We support this Opposition Day motion, but we also hope that it is worth more than the paper that it is printed on. Thank you, Mr. Speaker.
Questions and comments? The Honourable